So the question is, breast lift after implant removal, small A cup breasts. I cannot find any photo examples of small breast lifts after breast implant removal. What type of lift can be used on small A cup breast after implant removal? D cup, high profile, 300 cc's, textured, mentor, subglandular. Subglandular means that it is above the muscle. When it is above the muscle, the loss of volume with the 300 cc's gone is going to be much more apparent than when the implant was submuscular. Now what happens is, because it's subglandular, the only thing that's, if you will, holding the implant is the skin, and the skin stretches. Now, whatever the amount of glandular tissue you have is what you're going to have, what you had before. The implant has truly worked as what is a tissue expander because it's gravitated downward and outward, since there is nothing sturdy that's holding you. What has happened is, over time, as you have aged, for the length of time you have had the implants, the breast tissue has atrophied. So someone who's 25 has more breast tissue than when they are 35, when they are 45. I saw a mammogram on a patient 70, and she had essentially all fatty tissue and no glandular tissue, because over time the glandular tissue atrophies. Just the fact that the patient has an implant in the proximity of the breast tissue atrophies just for that reason alone. How much we do not know. With the implant gone, the breast tissue is now going to get a chance to, quote, fluff out. I remove, in my practice, the excess skin at the bottom, which is what was a tissue expanded out. And then I put internal sutures, and that helps lift the breast tissue up. If you were born with a amount of breast tissue, even after explant, you're going to be left with not only A, but less than A, because of the age, because of the proximity of the implant next to the capsule, and because of the inflammatory effect. That swelling that you have is going to be less, because that swelling is going to go away when the implant is removed. You're certainly going to be left with that A cup, because that's what you were born with, that's your intrinsic ability, and that excess skin certainly can be removed. Because of your recoil capability of the skin, depending on your age, a lift is not always necessary. And in my practice, 80% of the patients who choose to explant do not need that unnecessary lift.